Hi everyone, we're back with another show on the Health Manifesto podcast. Each week we explore the latest health-related science and technology, and more importantly, how to apply it to your everyday life. We're here to bring clarity, not confusion. And today's topic? Like always, it'll hit home for almost everyone. Welcome back. This is episode 4 of the Health Manifesto, and today we're pulling back the curtain. We're stepping into a space that's polished, professional, and convincing on the surface. A space full of confident language, branded reassurance, diversity campaigns, and scripted empathy. The healthcare system. But not the one that saves lives in emergencies, not the one that performs open-heart surgery or treats third-degree burns. This episode isn't a takedown of emergency medicine. It's a reckoning with something else entirely. The way everyday health has been turned into performance. We're talking about health theater. That means the illusion of care. The systems that look like they're helping but aren't built to heal. The clinics with friendly posters and clean floors, but rushed doctors and 7-minute visits. The platforms that promise access but gatekeep outcomes. The wellness plans wrapped in pastel and positivity, but designed more for containment than transformation. You've probably felt it. That moment in the waiting room when you know you won't be heard. That moment in the consultation when the protocol takes precedence over your story. That prescription you walked away with but never took, because deep down you knew it wasn't the answer. We call this care, but is it? Or is it compliance? Because when you really look at how modern healthcare is structured, especially in the US, the UK, and many other industrialized systems, you start to see the disconnect between what's promised and what's delivered, between how it's packaged and how it feels. The system wasn't built around your healing, it was built around managing populations. That's not conspiracy, that's public policy. And if you look at the incentives, it becomes clear. Most healthcare systems, public and private, are optimized for cost efficiency, liability reduction, and standardized compliance. Not for listening, not for deep prevention, not for root cause transformation. Primary care physicians in the U.S. see an average of 20 to 24 patients per day. That's about 15 minutes per person, and in many cases, much less. A 2021 study in JAMA Network Open showed that even for preventive care, physicians spend just over 16 minutes on average, which includes data entry and admin. That leaves barely enough time to understand your full context, let alone hear your story. So instead, we get streamlined diagnostics, pill-first protocols, printouts, specialist referrals, symptom charts. It's not about wholeness, it's about throughput. And the more complex your story is, the more you've lived through, the more trauma you carry, the more nuanced your symptoms, the less space you're given. So where do we go when we realize we're not really being seen? That's where this episode begins. Let's go further. Let's talk about the way protocols, even the well-meaning ones, can quietly override people. There's something unsettling about sitting across from a clinician and realizing they've stopped listening. They're still nodding, still making eye contact, but their mind is already writing your chart, preloading your diagnosis, matching your symptoms to a code. The moment you say fatigue, a branch of protocol activates. The moment you say anxious, another set of rules comes online. This isn't their fault. It's how the system trains them to operate. Because the system doesn't reward deep listening, it rewards correct coding. Every diagnosis has a billing code. Every procedure has a protocol. Every deviation introduces risk. So personalization becomes liability. And what gets sacrificed? You. Not your chart, not your symptoms. You, your story, your context, your complexity. And if you've ever walked away from a medical appointment feeling more like a checkbox than a person, this is why. Here's an example. A patient says, "I'm exhausted. I can't focus. I feel low. My digestion is off." A protocol might flag this as depression or IBS, not trauma, not endocrine dysfunction, not chronic stress. The system doesn't ask what happened before the symptoms. It asks what label can fit them now. And once the label is assigned, the conversation narrows. You've moved from person to protocol. The result? People feel unseen, unheard, misunderstood. And over time, they stop trying to explain. They shrink themselves to fit the format. They stop naming the full truth of their experience because they've learned it won't fit into the form. This is how care becomes performance. A play with set roles. The patient, compliant. The doctor, authoritative. The chart, definitive. But healing doesn't work that way. Real healing is messy, nonlinear, full of nuance and contradiction. It requires time, trust, a relationship, not just a visit. And here's where it gets more complicated. A lot of providers want to offer that kind of care, but they're stuck too, caught in a system that overbooks, underfunds, and penalizes deviation. They're exhausted, burned out, emotionally detached because they have to be. So we have a system full of patients who don't feel seen, and providers who don't feel safe enough to see. That's not health, that's theater. And it's time we name it. Because what happens next, after enough of these moments, is something quieter, but just as damaging. People start to internalize the failure of the system as their own. They leave the appointment and think, maybe I didn't explain it well enough. They read the side effects of the medication and think, maybe I just need to try harder. They start to doubt their own instincts, their own symptoms, their own story. This is the emotional cost of health theater. The erosion of trust, not just in medicine, but in yourself. Because when your suffering is flattened into a protocol, when your lived experience gets rewritten into bullet points, you start to question whether your pain is valid at all. You become less likely to speak up next time, less likely to seek help, less likely to trust your own signals. That kind of disconnection? It doesn't just silence people, it suppresses recovery. Because the starting point of healing is agency, not authority. It's someone saying, I believe you, not, I've already decided. And yet many people walk away from appointments with more doubt than clarity, more shame than support. It's not that doctors don't care, many deeply do. But when the system treats care as output and patients as data, the emotional collapse becomes inevitable. We need to talk about that collapse. Because that collapse doesn't always show up as a breakdown. Sometimes it looks like silence. Sometimes it looks like withdrawal. Sometimes it looks like someone who stops seeking help altogether. It looks like a patient nodding politely through an appointment they no longer trust. It looks like someone going home and Googling their symptoms alone, late at night. It looks like a parent who feels something is wrong with their child, but has been dismissed so many times they don't speak up anymore. The collapse doesn't always scream. Sometimes it just slips quietly into resignation. And that resignation is dangerous because it teaches people to abandon themselves. They stop advocating, stop questioning, stop believing their own pain. They start doing what they're told, even if it doesn't feel right. And on the surface, this looks like compliance, but underneath, it's defeat. And this is how health theater becomes self-reinforcing. The system mistakes silence for success. The absence of resistance gets misread as agreement. People are giving up, not because they want to, but because they've been taught that speaking up doesn't change anything. And this is where things start to break. Because the longer someone stays in this state, quiet, compliant, disconnected, the more deeply it affects not just their emotions, but their physiology. Studies in psychoneuroimmunology have shown how emotional suppression and chronic invalidation can dysregulate immune function. When someone feels helpless or unseen over time, cortisol stays elevated. Inflammation rises. Digestive health deteriorates. Sleep fragments. Memory, focus, and emotional resilience start to slip. And in this loop, the body adapts. But it doesn't heal. It compensates. It hides the signals until they become symptoms. What started as a story becomes a lab result. What started as a quiet warning becomes a diagnosis. This is the hidden cost of health theater. It trains people out of their own knowing. It teaches them to outsource intuition. It pathologizes complexity. And over time, it erodes the belief that healing is even possible. So how do we begin to restore that belief? We start by listening differently. We make space for the story before the symptoms. And we help people remember that their body is not the enemy. It's the messenger. We'll pick it up from here. Because restoring belief in healing starts with reclaiming the story, not the one written in the chart, the one that lives in your tissues, your timeline, your lived experience, the one that got interrupted, invalidated, or reduced to a list of symptoms. And it's not always easy. When you've spent years being told to mistrust your body, it takes time to trust it again. When you've been taught to speak in bullet points, it can feel strange to speak from your gut. But this is where the real work begins. You start by remembering. The moments when you felt dismissed. The times you didn't speak up. The signals you ignored because someone else told you they didn't matter. Then slowly, you begin to retell it. You name what hurt. You name what helped. You honor what your body endured. And you remind yourself you were never broken. You were never crazy. You were adapting to a system that wasn't listening. And as you do this, you create space. Not just for healing, but for sovereignty. Because when you reclaim your story, you start to move differently. You ask different questions. You take up more space. You stop shrinking to fit protocols that were never made for you. And maybe most importantly, you start believing in something again, not in the system, not in the next expert, but in your own capacity to heal. Not perfectly, but honestly. Not quickly, but deeply. And that changes everything. So where do we go from here? We start imagining a different kind of care. Not aspirational, not idealistic, just human. A system designed around relationships, not metrics. A rhythm of care that centers curiosity, not compliance. A practice of medicine that asks better questions, not just faster ones. It starts with longer conversations, with providers who have space to think, not just react. It starts with exam rooms that allow for silence, for story, for nuance. It starts with letting the patient, you, speak first. Not about what hurts, but about what matters. Because healing isn't transactional, it's relational. And if we want to build a system that heals, we have to stop treating people like problems to solve. We need more time, more listening, more continuity, more trust. We need to recognize that medicine, when done right, is not a performance. It's presence. And it's presence that heals, not the script, not the scan, not the stats. Presence that says, I see you, I'm with you. We're not rushing this. That's what people remember. Not the paper gown, not the prescription, but the feeling of being held by someone who isn't in a hurry. That's what breaks the illusion. That's what ends the theater. And that's where real care begins. So as we bring this episode to a close, maybe the question isn't, what should I do about this? Maybe the better question is, how do I want to be with this? How do you want to be with the part of you that felt dismissed? With the version of you that kept quiet? With the ache that wasn't seen, but never left? This isn't about blame, or fixing, or even understanding everything right away. It's about sitting with what's real, with your own story, with your own knowing, with your own pulse. And slowly, breath by breath, choosing not to abandon yourself again. Because even if the system didn't believe you, you can. Even if the care felt scripted, you can write a new script. Even if the structure was too rigid, you can become more fluid. Healing begins in those small, quiet moments of return. Moments when you soften, when you notice, when you stay. So maybe that's where we end today. Not with action, but with awareness. A quiet re-entry into your own rhythm. We'll be back next time. Thanks for tuning in to the Health Manifesto. This show is about one thing: helping you understand the systems around you so you can take smarter, simpler steps toward your own well-being. We'll see you next time.